Namaskar. You all are welcome in today's Gyan Darshan teleconference session organized for Post-Basic B.Sc Nursing program. The Post-Basic B.Sc Nursing program of School of Health Sciences was launched in year 1994. The first revision was done in year 2005 and the second revision with all updated contents has been launched in year 2021. And to update and to add on value, the revised material has been added with integrated logbook of CCH program. So we will be discussing in today's session how the integration has been done and how the students will be using the logbook of CCH program which has been integrated in BNS 209 Community Health Nursing course and for which the student has to work from first year onwards. So to discuss in detail the integration of logbook, we will be discussing with Dr. Reeta Devi ma'am. She is course coordinator of the program. Myself, Dr. Laxmi. I welcome you ma'am. So first to begin with, I request madam to just highlight in brief about CCH program.
Thank you, Dr. Laxmi. As students are aware that IGNOU has launched Certificate in Community Health Program in collaboration and funded from Ministry of Health and Family Welfare. This program was developed under an MOU signed with Ministry of Health and Family Welfare, and this Certificate in Community Health Program is 6 months program and to give competencies to the nurses as well as Ayurveda graduates to enhance the comprehensive primary health care services at health and wellness centers, and after completing this program they are being posted as community health officers in the various states across the country. So till date, after launching in 2017, till date around approximately 35,000 community health officers have already been trained by IGNOU. And in the year 2020, Indian Nursing Council in collaboration with the ministry integrated this logbook in the conventional mode of basic B.Sc nursing program in the internship, and those who are passing after 2020 with basic B.Sc nursing, they are being posted directly as community health officers. So, and many students were even requesting in IGNOU also to integrate this logbook in post-basic B.Sc nursing also, so that they can also get the benefit of being posted as community health officers after they complete their post-basic B.Sc nursing of IGNOU. So hence the thorough work had been gone in developing this integrated logbook, and in post-basic B.Sc nursing, as Dr. Laxmi has mentioned, it is a value addition in the program. So first time in post-basic B.Sc nursing of IGNOU, we have incorporated the logbook, which was not earlier there, and students were writing all the self and supervised activities in their diaries and registers. But now this has added as a logbook in which they can record all their procedures, and this has the guidelines and the formats available, ready-made formats available in which they can very well document their procedures, and this logbook is prepared, which will be available from 2023 batch onwards. So all the students who are getting enrolled in 2023 year as first year students, they will get in their material this logbook also in the first year itself, so that throughout 3 years of the program, they are being identified to carry out these activities in the first year. The activities are demarcated to be carried out in second year, and activities to be carried out in third year. So all these are included in this logbook.
So ma'am, after all the groundwork, it has been identified from CCH content that what all activity will be there in first year,
Yes.
related to CCH and what are in second year and third year. But apart from this, they will have to do all the practical activity of the respective course separately.
Yes, separately. They have to do because first year is having BNS 201, then 202 also has blood test, 203 is maternal health. All these three courses are having first year activities as self and supervised activities, and they have well developed practical manuals also. So they will be doing all those activities apart from doing these activities which are there from the CCH program. So, as I told, that 12 activities of CCH program, because they are being covered in because mapping, after doing the mapping of CCH program with post-basic B.Sc nursing program, then only we identified that these 12 activities of CCH program are matching with the first year courses. So they can do that in the logbook, and rest of the activities they have also to carry out as per the details given in the practical manuals of these courses.
Ma'am, will you please explain in detail the integration of logbook in community health nursing?
Yeah, yes. For integration, before we go to the integration, let us see when we are integrating this logbook. So this is the most important component, and so students and everybody should know that what are the objectives of integrating this logbook. So can you just tell the objectives?
So, ma'am, like logbook, we are saying integration of logbook. Logbook is a kind of ready-made or hands-on information in which the detail of the procedure is given, the guidelines are given. So it is the first-hand information available for both students and as well as for the academic counselor. And based on that information, the learners will be able to prepare beforehand what all is needed, and so they will be able to complete those activities in the time-bound manner. Yes. And the last objective is that, like, it is yearly divided content is there. Yeah. So whatever they are doing in their respective course and what they have to write in logbook, which is also very much mentioned. So this is also one of the objective of the logbook, like year wise they have to record their activities to be done in the logbook.
Yes, and before they go to the logbook, first of all they must read the practical manuals, because every detail of the practical is given, how to carry out that practical, what all points to be remembered, what all equipments will be required, and how to carry out the procedure. Everything they must know, student must know before they enter the things in the logbook. Logbook is having the formats in which, but it is by virtue of your experience, by virtue of reading the practical manuals, you have to go through the list of activities which are given in the logbook, so that you can plan that which activity you will carry out, which activity to be carried out in the lab, which activity to be carried out in the nutrition lab or in other labs, etc. So you should know the list of the activities, and you read all the activities and then only start using this logbook. So when we are, as we mentioned, that first year has 12 activities. So in these 12 activities, apart from, as we have explained, that these 12 activities which are listed separately, like these are the 12 activities of first year, and these are 12 activities are being given the reference material where they can carry out. Since hand washing skill is the most important, we cannot neglect hand washing till third year. That is why it has been taken here, and first year should cover hand washing skill. Biomedical waste management, which is part of 201, that is first year course. Procedures for the basic test is again the from 202, that is applied sciences, then health assessment of women, and rest all activities are from the maternal health nursing course, which is 203. As you students are new, so you will get familiar to these codes from time to time. So maternal health nursing has many activities like assessment and care of the antenatal women, monitoring during labor and partograph, conducting vaginal examination, conducting episiotomy, care during various stages of labor, postpartum care, identification and management of complications during labor, and assessment and management of STIs and RTIs. So these are the list of 12 activities which are there in CCH program, which are also there in the post-basic B.Sc nursing program. So these are being, comparable, and because the logbook is already there in which was prepared for CCH program. So those were reformulated, transformed to be placed as per the first year of activities, so that it is easy for you that you open the logbook as first year and then carry it out. And student, you must remember that this logbook will be provided to you with the first year only. When you will reach in second year, same logbook may you will carry out the work of second year, and followed by when you will reach in third year in the same logbook. So keep it very safely, don't spoil it, and you at the end of 3 years it will be evaluated by the evaluator when you will be appearing in the community health nursing practical examination. So this you must. So can you explain about second year activities, Dr. Laxmi?
Yes, ma'am. Like in first year, you have seen there were 12 activities were covered in different courses of first year, like 101, 201, 202, that is applied science. In same way, in second year, there are total 5 activities which has been integrated based on the CCH program. Activity like resuscitation of newborn, because in second year you will be learning pediatric nursing course. So in pediatric nursing course, as a part of CCH program, there is a resuscitation of newborn, assessment of newborn baby, kangaroo mother care, infant and young child feeding, and promoting and monitoring growth and development, and plotting chart. So all these are the will be the there are total 5 activities that you will be doing in the logbook. Please keep in mind, you will be doing all the self and supervised activity of second year courses separately. But for the CCH program integration, you have to mention these 5 activities in the logbook, and there are minimum 2 activities to be done in the logbook, one under supervision and one with your own that you have learned the activity. So that record will be maintained in the logbook.
Yes, and you have very rightly said that 2 activities minimum. Out of these 2 activities, one activity has to be done under supervision, because you are attached in a group of 1:10 ratio in the clinical area under the supervision of a academic counselor. So academic counselor is supposed to teach you one activity at least under their supervision, followed by that supervision you will carry out that procedure yourself, and that becomes your self activity. And I think because you are new to the system, so there is difference between self and supervised activity. Self activities are those activities which you, as you are all in service nurses, you are already working. So self activities, you can just read the list of self activities which you can carry out yourself in your workplace also. And for supervised activities, you need to be, attached to the program study center where academic counselor is there, and he will or she will teach you first. After that, you carry out that activity. So minimum 2 activities, out of that one has to be supervised activity for completing the logbook or activities present in the logbook.
Ma'am, will you please show the format of the logbook for any of the activity?
Okay, yes. When you will get this logbook, after reading or how to use the logbook, what are the objectives of using the logbook and the table or list of the activities, then you will start getting the formats. As we were telling you, there are formats. Suppose activity 1 is on the resuscitation of newborn, and this activity, when we say reference material, so reference material is in the box given over there, where you can, it is written that, first of all, it is written PSC. The activity you can carry it out at the Program Study Center. PSC means Program Study Center. And refer, when we say refer material, so you will refer BNSL. And dear student, L over here is for the practical course when we write L. So BNSL is 207 is the pediatric or child health nursing practical, having block 1, and in this block 1 unit 2. That means you will read this unit 2 of block 1 from BNSL 207 to know about this activity. And then after you read it, academic counselor will demonstrate you, and after the demonstration you can record for which patient this activity was done. Guidelines are also given here, like select 2 newborn babies who require resuscitation, prepare the equipments required for resuscitation, and perform resuscitation as per the steps which are explained in this refer material, which has been written in the box. And then you record in the logbook. Now comes your term is to use the logbook. That you will record the name of the health facility where you have done this procedure, which date you did this procedure, date of registration, and registration number of the patient, if he is indoor patient. And then identification data, name of the newborn baby, relationship with the head of the family, age, monthly income, education, then the marital status. That depends upon what kind of activity where you are doing. If it is an adult, maybe marital status you can write, but in case of newborn baby, you can just leave it blank. Then occupation of the parents, if there, and then guidelines are also given in the format, like prepare equipment used in the resuscitation, maintain room temperature, and arrange all the equipments like suction equipment, bag and mask, intubation tubes if required, any medication required, and miscellaneous. And after you, and what are your findings, that you can write down in the box provided blank space. Also management, and could you manage it, or you have referred it to higher health facility. That also you can write at the end of the box, and follow the steps of resuscitation procedure. Same way, and these are the steps which are already given here, and what all steps you have followed, that you can mention. So let us take the activities of the third year. Third year is your when 2023 batch, they will reach in second year in 2024, and the same batch will reach in third year in 2025. So your logbook is with you for all the 3 years, and when you will reach in third year, that time you will also open logbook, same logbook, and start doing the third year activities. In third year we have 2 practical manuals. Practical manual 1, which is having total 17 practicals, and practical manual 2, this is the specialty integration word which we are telling again and again. So this practical manual 2 is the mapping of curriculum of CCH with the post-basic B.Sc nursing, and we identified that out of so many 46 activities were there. Out of that, these 20 units were adopted from CCH program, which were not there in the post-basic B.Sc nursing. So these 20 units adopted, and we made one more practical manual, and even the credits were added to the whole program. Previously this course was of 8 credits in practical, and now 8 plus 4 more credits were added, and it became 12 credits program. Previously we were taking the practical contact session for 15 days, but in third year 7.5 more days are added. So total 45 sessions have been there, been added in the third year. So you will be called for 22.5 days instead of 15 days in third year for BNS 209 practical. So if you see the table, what all activities, because these activities will make you competent to work as a comprehensive primary health caregiver or to be eligible to be a community health officer. So what all these activities, we can just name down few out of the whole tape, like community assessment and identification of community common health problems, health assessment of a individual, nutritional assessment, and assessment of identification of the nutritional deficiency diseases, organizing and conducting special clinics. So here we are teaching you how to conduct a non-communicable disease clinic, adolescent health clinic, mental health clinic. So these are the need of the hour at rural health facilities, and you will be equipped to do these activities like social mobilization skills, which was not there in post-basic B.Sc nursing. Then recording and reporting formats, and nowadays a lot of IT skills have been added, soft skills have been added. So these you will be knowing few more very important. So drug dispensing, very important at primary health center level or at sub-center level, which drugs are appropriate to be handled by a community health officer are being, you will be knowing in the skills. Then there are suturing of the superficial wound. This you were just learning in the medical surgical nursing, but this is the skill which you should be knowing, as you can handle some of the patients with this need. So you will are given this thing. Then adolescent counseling, as I told you, management of abortion and counseling. So these are the very important activities which at rural level also you need to know to handle, and you should be competent enough to handle the patients at rural setup. This is the objective behind equipping you with the CCH or the Certificate in Community Health program and integrated it with the post-basic B.Sc nursing. So it has been value addition to the post-basic B.Sc nursing program of IGNOU, and we hope that you will take interest in carrying out all these activities at your level and strengthen the program and do your best in the program.
So, ma'am, to perform all these activities, they will be posted at the district hospital or the community health center, as they were earlier also posted in the. That is why we have taken it to the community health nursing course. Any other take-home message which you want to give to the students?
Yeah, this is very important, as Dr. Laxmi has mentioned, that, you know, under the Program Study Center, which is a college of nursing. So you will have to see, but in CCH program, we are giving these activities at district hospital level, and from district hospital level they are going and placed in the community health center and primary health center, even sub-center, urban health center. They are being posted in that program because actually they have to work in the community setup. But here you will try your best from your side to take initiative. Although you must have done the posting during your GNM time in CSC or PSC or sub-center, but at the college level, if the college of nursing is attached with some district hospital or PSC, CSC, and so at least observational visit can be paid by with the effort of the PIC to all these other health facilities apart from the College of Nursing with which their community field is attached. So you try your best to get opportunity from your own efforts, you can put, as you are in service in the rural area, you can go and visit these health facilities from your side, as well as with the help of the program study center, and try to learn and be affectionate with the community to whom they are in your need, that this is the thing that they are in need, and you are as a professional there to support them, so that we can achieve the sustainable development goals and the mission of Ayushman Bharat.
And the beauty of the IGNOU material is self-learning material. Once you will be reading the material, you will feel that teacher is talking to you, and in between there are some questions as teacher asks, our material is also asking you and filling up that answer, and answer is also given at the back. So we will be discuss in detail during other counseling session that how to read the material and how to go about with the course. So with this, I thank you, Reeta ma'am, for explaining the integration of CCH Logbook in Community Health Nursing course of Post-Basic B.Sc Nursing program.
Thank you.